Good afternoon. Boy, it's good to see a lot of old friends here. I feel like a spectator at a Brain Injury Hall of Fame meeting here. Many people that I've spoken with over the years. I haven't seen you in quite a while. I haven't spoken on this subject in a while because I went off and started doing mass torts. I didn't have enough challenge just trying to handle a simple brain injury case. I had to go take on 10, 15,000 clients at a time. I've been talking on this subject for about 30 years now, and I'll hasten to say it's not the same speech, it's just the same topic. But we've come a long way from back in the 80s and late 70s when we were trying to establish that PTSD actually existed. And we had so many cases where Dr. Larry Pollack and Dr. Ralph Lilly and we'd be trying to prove up that there really was such a thing as a mild brain injury that didn't show up on any of the radiographic testing. So we've come a long way from that. Unfortunately, through the military, we've had the bad experience of seeing that come to the fore with the PTSD, and now through the NFL and all the concussions. But we've come a long way in a lot of other aspects of it too. And I want to mention what we used to try to prove as the misnamed mild brain injury that we had a lot of those cases back in the 80s. I'd be hard pressed to take a mild brain injury case today in Texas because of the difference in the jury, the makeup of the juries, and the requirements of proof. But we used to make the arguments. I know our favorite thing on the mild brain injury was we'd stand up and say on voir dire examination that the defense theme in this case is that if you can't see it, it's not there. If you can't see it, it's not there. Now, this is an injury that doesn't show up on MRI, it doesn't show up on CAT scan, it doesn't show up on x-rays, it only shows up on autopsy. So then we start out voir dire by asking, now, are there things in your life that you can't see, but they're actually, you know they're there, they do exist? And they'd come up with things like oxygen and things of that nature. So we'd take away that defense right off the bat on voir dire examination. But then we'd have to go through the whole process of overcoming the fact that the neuropsychologist is not an MD, but he'd say, no, I'm the person to whom the MDs refer their brain injury patients when they have this type of injury. So I want to talk to you about something a little different today. I want to go back to the basics of what is our message, how do we couch it differently today, but mainly about the demographic target of our message, because that has changed so much. It's changed. We used to try cases to the boomers, and the boomers awarded a lot of money in our cases. And then along came Generation X, and Generation X they were the tort reform generation. They were the perfect target, demographic target for the tort reformers, and it worked. It worked in spades with them. And so we took a big setback with the tort reformers, with Generation X. But now we have a new demographic that are the targets, and trying a case today to the dominant members of our jury is different than it was 30 years ago, 20 years ago, or 10 years ago. So I want to talk to you a bit about that. So let's start with just the message and our approach to the message. We have the messenger, the message, your means of delivery, your audience, and then how the audience processes the information. Now, we as attorneys focus on the messenger, which is ourselves, our expert witnesses, the people that we're putting on the stand, the message, and in focusing on our message, I've always believed in Einstein's statement that make everything as simple as possible and no simpler. So we have to go with simplicity on our message. Because brain injuries can be complicated enough without us unduly complicating them with a complicated message. Our means of delivery, I'm going to show you some things that we devised in terms of visual evidence, in terms of means of delivering our message. But then the real message itself is determined by the audience. What message do they receive? And what message do they process through their brains in arriving at their conclusions? And a lot of times there's a fundamental disconnect. When you lose a lawsuit, when you lose a brain injury case, you find out, and I've lost brain injury cases, and I've debriefed jurors afterwards, and I found out that there was a fundamental disconnect between the message I thought I was delivering and the message they were receiving. So the way to avoid that, the way to reduce the likelihood of that occurring, is through focus groups. You want to make very sure that the message you're delivering, or you think you're delivering, is the same message that they're receiving and the same message that they're processing. And then how are they processing it? So you do that. The processing, remember, this is something that's had a slight change too. This is very old data here, but there's a slight change in this with the new juries we have. When we're delivering messages, our message is delivered, the verbal communication that we use, the words we use, is only 8% of the delivery of the message. That's not to say that words are not important. Words are vitally important, vitally important. And we work with focus groups in arriving at the right language of the case for this particular case. What are the words that they use? We put our message out there in plain vanilla presentation, and then we listen to the language that the focus group uses in how did they describe the injury? How did they describe what's going on in my case? And then we try to use their words and the words to communicate with the jury. Vocally, 37% of the delivery of your message. And the vocal communication has become, along with the verbal, has become less important, and I'll tell you why in a minute. But the vocal communication is the sincerity in your voice as much as anything else. The fact that you're confident, you sound, this is important, you sound as if you believe what you're saying. You sound as if you are sincerely conveying a message in which you believe. Because if they get the sense that you're just a hired gun reciting a message that you're paid to recite, if you don't believe it, why should they? So the first proposition is, if you don't believe in your own client's case, if you don't believe in the case you're trying, then get the hell out of the way and let somebody try it who does believe in it, because it's a vast disservice to your client for you to stand up and try to convey a message or a case that you personally don't believe in, because through nonverbal communication, through vocal communication, the jury will pick up on that and they'll punish your client for it. So vocal communication is 37% of the delivery of the message. Now, this leaves 55%. Nonverbal communication is 55% of the delivery of your message. Now, nonverbal communication includes all the visuals that we're going to talk about. It includes all the things that they see with your client as they're watching your client. And one of the major problems you have in a minor brain injury case, I even hate using that term, it's an absurd term, but one of the things they see in a minor brain injury case is when they sit there for 4, 5, 6, 7 days and they watch your client, and they watch your client during the breaks, and they watch your client in the hallway, and they watch your client all over the place during 4, 5, 6 days of trial, and your client appears perfectly normal. They see nothing. So that nonverbal communication, 55% of the delivery of the message. They watch the relationship between you and your client. They watch the relationship between the client and between every witness. So they're always reading nonverbal communications of everybody. So we tried, in trying brain injury cases, I always try to not have the client present for the trial. And I don't have them present for the trial for just that reason. I'm talking about the person who is not visibly hurt, injured, brain injured. I try to not have them, and the reason I get them excused from the trial is I would go to the court and say, Judge, my neuropsychologist will tell you that it will be detrimental to the client to sit there and listen. He's been into therapy, he's been in rehab, and if he sits here and listens to 5 days of testimony about how brain injured he is, it's going to be very detrimental to him. So we bring the client in and we introduce the client to the jury, and we have the court explain that the client is excused from being in the courtroom because of what his doctor said. And then we have the doctor explain why the client is not in the courtroom. So we bring them in, and they see the client, and usually the client, if they testify at all, will give the briefest testimony of anybody in the case, because you don't make a brain injury case through the brain injury client's testimony. Then you come to the message is the message that's received, and the message is the message that's processed. And by process, we mean people process our messages in three fundamental ways. They process it auditorily with what they hear. They process it visually with what they see. But then they process it kinesthetically. And kinesthetic processing means that this is the nonverbal communication. This is where the unconscious mind, or what Kahneman refers to now as the slow thinking mind, is perpetually gathering information. And so they're gathering information that may be adverse to your case. They don't realize they're gathering information that's adverse to your case. They don't realize it's adverse to your case. But the unconscious mind is gathering all this information. And that's what happens when you have a traumatically brain injured person sitting there in the courtroom with you who looks perfectly fine. Every day they're gathering information that this person looks perfectly fine. And so that doesn't set well when they start trying to evaluate damages and the nature and extent of the injury. So, but the kinesthetic processing is what happens when they get in the jury room and they say, you know, I heard the plaintiff's argument, and it was very compelling. It was very persuasive. But you know, something about this client's case just doesn't feel right to me. And that's the kinesthetic processing, which grows out of what they gathered in nonverbal communication. So that's why Eric Oliver, who's a great trial consultant, told me one time, and I couldn't understand this for a while, but it finally sank in, that don't ask a juror why they decided the way they did, because they don't know the answer. And the reason they don't know the answer is because so much of the basis of their decision came out of the nonverbal communication, out of what they saw and what they processed in the unconscious mind. They don't even realize that's why they made the decision. So Eric says, you don't ask them, why did you make this decision, or what was your basis for this decision? You ask them a lot of other questions. There are ways to debrief them and get the same information, but they really don't know exactly why.